Hello everyone, welcome back to Nursing Guru. This is Manoj here. Hope everyone are studying well for your exam, and those who have already started, I think like it will be a bit tensed when it comes to the anatomy physiology part, but no worries, like we are here to help you out, and we will be discussing multiple videos showing like how you have to present your examination patterns, everything, paper presentation, all those things in the detail. But still we are going in like the unit wise discussions. So today what we are going to look into is that is unit number 5, which is a physiological part called endocrine system. So physiology part, unit number 5, endocrine system is the thing that we are going to discuss for today in detail. So this will be a quick revision as well as the entire discussion of the SEM as well as the GNM, mainly focusing on the BSc first SEM people. So this is the blueprint as discussed in multiple videos. So this is the blueprint which is given for the first SEM basic BSc nursing students. So this is the applied physiological part. So today we are going to discuss that is unit number 5, which is unit number 6, that is endocrine system. Now the unit number 5, sorry, it is a unit number 6. So unit number 6, that is in this chapter you will be carrying short answers 1, and next if you see there is a 1 MCQ. So totally 2 plus 1 you will get 3 marks. So in this chapter, that is unit number 6, you will get 3 marks, that is 1 short answers and 1 MCQs will be your examination point of view. Clear? So for the GNM, as already discussed, you will not be having any particular blueprints or something as such. So only thing is you can mainly focus on the previous year's question paper and also the syllabus copy given by the board. Clear? So let's go into detail. So what is meant by endocrine and how it goes and what are the regulations as everything. So first is the glands. Gland is an organ which secretes a particular chemical substances for use in the body or for discharge into the surroundings. So anything which secretes particularly a chemical substances, then it is said to be a glands. There are 3 types of glands in our body. Number 1, so this will be the 2-mark question directly for both the GNM as well as the BSc. So what are the 3 types of glands are? Number 1, endocrine glands, number 2, exocrine, and number 3 is heterocrine glands. So there is a diagram which is depicting that what are the like endocrine system parts, or which are the organs that are said to be the endocrine system. It is given here. Anyways, we will be discussing in detail about this. So just as a brief, hypothalamus, pituitary gland, thyroid gland, pancreas, testicles, pineal gland, thymus, adrenal gland, and ovaries. So the another 2-mark question that you can expect for both of you is, that is SEM as well as the GNM, is list the endocrine system organs. So then you have to mention at least 4, maximum up to 5 to 6. Okay. So next is what is exocrine. So you know what is a gland and what are the types of the glands. And next let's discuss one by one just as a quick brief. So what is mean by exocrine glands are, exocrine glands release substances through openings, which is also called as the ducts, into our body surfaces. So any substances which will be released into our body through openings, which is called as a duct, is said to be the exocrine. Exocrine glands secrete sweat, tears, saliva, milk, and the digestive juices. They secrete these products into the ducts. So duct is not, it is something called as openings. Okay. So here if you see exocrine glands, their locations as well as what they secrete actually is clearly mentioned here. So this will be also for your 2-mark question. Here if you see, first, eyes is an organ which secretes a tear, mouth secretes saliva, skin secretes sweat and sebum, stomach secretes enzymes, breast secretes milk, liver secretes bile, and pancreas secretes juices, intestine secretes mucus. So these are the locations and what they exactly secrete as a function that is clearly mentioned, which is important for your 2 marks. Okay, and any one will be there in your MCQ as well. So what are the examples of exocrine glands are? Sweat glands, salivary gland, mammary gland, stomach, liver. So these are the examples of the exocrine glands. So examples, so like first if at all they ask exocrine glands for your 2-mark question, so the definition you should write followed by the examples, and if possible try to write the secretions along with the part of the endocrine glands. Okay. Next, what is heterocrine glands? So exocrine we discussed, and next is the heterocrine. So heterocrine, these are glands that perform both exocrine and endocrine functions. So which includes the properties of both the exocrine as well as the endocrine functions, then they are said to be the heterocrine glands. So what is the example that you can give for the heterocrine glands are mainly the pancreas. So pancreas is the example for the heterocrine glands, which will be there for your 2-mark question again. And next, endocrine. So this is the main part that we are going to discuss for today in detail, that is unit number 6 of physiology, which is called as a endocrine system, which will carries 3 marks. 2 marks is for the short answer and 1 mark is the 1 MCQ. So what are the functions of a body that are mainly regulated by the endocrine systems? See, there are 2 regulating mechanisms, that is 2 major control systems which will comprises of endocrine gland, and its functions are: number 1, nervous system; number 2, hormonal or endocrine system. So nervous system and hormone, see the name hormones. So endocrine is completely related to the hormonal functions only. So what does hormone it is producing and how it works, everything will be included in the endocrine system. Okay, so that is why nervous system and hormonal or endocrine system will be the main function of the body to be regulated, okay, with the 2 major control systems. So the word endocrine is derived from the Greek words where endo means inside, endo always it is inside, and crines which means secrete. So anything which secretes inside the body which will come under the hormonal control is said to be the endocrine system. The endocrine gland is one of the body's regulatory system which is made up of a network of endocrine glands. So endocrine glands already we discussed in the first slide itself. So clear with the endocrine system, and next coming to the hormones. So this will be again your 2-mark question. So hormones are a chemical substances that are carried by a cell tissue and initiate specific action. So this is a chemical substances that are carried by a cell tissue and initiates a specific action. So each hormone has a individual actions which is called as a specific actions. Next, the pituitary gland and the hypothalamus. So we already listed the endocrine glands, and now let's discuss one by one in detail. So which will be there for your 2 mark as well as 1 mark. For the GNM, they may ask up to 5 to 6 marks as your explanation part. Okay. So the pituitary gland and the hypothalamus. The pituitary gland or hypophysis. So the pituitary gland is also known as a hypophysis. This is how the question will be interchanged in your exams questions. That is hypophysis. Hypophysis is also known as a pituitary gland which is attached to the hypothalamus at the base of the brain. Why it is called as hypophysis? Hypo means something lower portion. Physis. So what is physis means? It is a growth. Okay. So which is, see, pituitary gland is a pea-sized organ which is like developing under the lower portion of the brain. So that is why it is called as a hypophysis, which is attached to the hypothalamus at the base of the brain. See, base of the means lower portion of the brain. Now you came to understand why the pituitary gland is also called as hypophysis. This is the reason. The hypothalamus is the major integrating link between the nervous system as well as the endocrine system. Although the pituitary gland is sometimes called the master endocrine gland. So this is a direct question for both GNM as well as BAC. Multiple times the question is repeated. Dash is the master gland. So the answer is pituitary gland. Please ensure you are writing the spellings correctly. Okay, because it is a single like fill in the blanks where spellings are very much mandatory that it should be correct. Okay. Together, the hypothalamus and the pituitary gland regulates virtually all aspects of growth, development, metabolism and homeostasis. The pituitary gland can be divided into the posterior pituitary and anterior pituitary. So pituitary is also known as hypophysis, that you know, and what are the types is anterior pituitary and the posterior pituitary. The pituitary gland see, which is also called as hypophysis cerebri. Hypophysis, hypophysis cerebri, all are same only. These are referred as the master of entire endocrine glands, as it influences the activities of many other endocrine glands. So why it is called as a master gland or masters of endocrine glands is because it is regulating multiple functions. It is not only regulating only one function, so it is including the entire and comprehensive functions of the all endocrine glands, okay, whatever we have listed. So that is why it is called as a master gland. So if you see the hormones already we discussed with the definition, and this will be a 2-mark question again. What are the hormones of pituitary glands? So again, as you know that there are 2 types, one is anterior pituitary and posterior pituitary. So let's discuss one by one with the hormones. The anterior pituitary comprises of hormones called as growth hormone, thyroid stimulating hormone, adrenocorticotropic hormone, ACTH. See, GH means growth hormone, TSH thyroid stimulating hormone, ACTH adrenocorticotropic hormone, PRL prolactin, LH luteinizing hormone, FSH follicular stimulating hormone. So these are the anterior pituitary hormones, which is a repeated question for the 2 marks. And next, coming to the posterior pituitary. So what are the hormones that are involved in the posterior pituitary is vasopressin, which is also called as ADH, antidiuretic hormone. ADH is nothing but as antidiuretic hormone. Oxytocin. So these are the 2 hormones that will be responsible for the posterior pituitary functions, okay. So what are the hormones that are released from the posterior pituitary is vasopressin and oxytocin, and anterior pituitary these 6 hormones. Clear with this? So very much important. See, if you see here the same thing, it is clearly mentioned. So this is the posterior and in the anterior lobe. So from the 3rd ventricle, you can see there is a pituitary portal system. So this will be the anatomical part explanation, but still if you see here from the anterior pituitary, because of the pituitary portal system, there will be like secretion of hormones called as TSH, FSH, LH, ACTH, PRL, GH, what we discussed and mentioned here. The same way posterior lobe, if you see from pituitary stalk, from there hypothalamo hypophyseal tract, from there see the signal will come from the brain and then posterior lobe. So the posterior lobe will secrete the hormones which is called as a ADH and oxytocin. ADH is also known as a vasopressin. Clear? So these hormones are very much important for your 2 marks. And next, coming to the posterior pituitary. The posterior pituitary works as a unit with the hypothalamus. Although the posterior pituitary does not synthesize its own hormones, it does store and release oxytocin and antidiuretic hormone, which is called as a ADH, which is produced in the hypothalamus. Here if you see the posterior pituitary, why separately we have been highlighted is, this is a repeated question for both the GNM as well as the BSc, like name the posterior pituitary hormones and explain its functions, or just brief its functions. So first is OT. OT is nothing but is your oxytocin. So the oxytocin controls the uterine contractions during the delivery and milk ejection during the breastfeeding. So what is the main 2 functions of the oxytocin, which is a repeated question, is it helps in it helps in controlling the uterine contractions during the delivery. During the delivery, the uterine contractions will be mainly controlled by the oxytocin hormone only, and milk ejection during breastfeeding, that is during the lactation process, milk ejection, how it is taking place is because of the hormone called as a oxytocin. Okay, these are the 2 important factors. Next, ADH, that is antidiuretic hormone. So ADH causes retention of body water, controlling the body's water balancing mechanism. See, this ADH what is mainly does in our body is it causes retention of body water. So how much over the water that is being retained in our body, that is mainly controlled by the antidiuretic hormone. So diuretic means something is pushing outside, the water will be pushed outside, right? That process is called as diuresis. Antidiuretic hormone means the opposite of it, in the sense the water to be retained in our body, how much over, why the dehydration is not happening that much every frequently in like most of the individuals, is because of the ADH hormone. If this is working, if this is not working properly, then dehydration will be very frequent, understood? So it causes the retention of body water and it controls the body's water balancing mechanism. So one more question how you may get in your exam paper is, name the hormone which controls the body's water balancing mechanism. So water balancing mechanism, if that question comes immediately, your brain should tell that it is an ADH. Understood? You should answer the same. Next, coming to the hormones of the anterior pituitary gland. So posterior pituitary is done. Now let's move to the anterior pituitary gland. The hormones which are secreted from anterior pituitary gland affects the growth, nutrition and hormone secretion from a number of other endocrine glands of the body. So these hormones are considered as tropic hormones. So these hormones are considered as tropic hormones. Tropho means which is related to the nourishment. So any hormones which are related to the nourishment are mainly released or controlled by the anterior pituitary glands. By secreting these tropic hormones, the pituitary gland controls the activities of the most of the endocrine glands of the body, and therefore they are named as master endocrine glands. So as we discussed earlier, see, the pituitary gland controls the activities of most of the endocrine glands of the body. So we already listed the endocrine glands which are considering under the part of the endocrine system. So in that, it is not only the one function that it will control, since it is controlling multiple functions, multiple systems functions. That is why it is called as a master endocrine gland. Clear? The hormones of the anterior lobe of the pituitary are mainly secreted from the different chromophil cells. See, if you see here, these cells are synthesized, storing and secreting different hormones, different cells, and the hormones which are secreted from there are as follows. See, if you see, the hormones which are mainly responsible for the anterior pituitary gland, already we discussed those 6, but from where they have actually come, that is somatotroph cells, because these are called as tropic hormones. So everywhere if you see, there will be trophs. Somatotroph cells which secretes the GH, which is called as a growth hormone, or somatotrophin and prolactin. Somatotroph cells secretes GH, growth hormone, and somatotropin and prolactin. Next, thyrotroph cells. These secretes thyroid stimulating hormone, which is also called as an TSH. Corticotrophs, it secretes corticotropin or adrenocorticotropic hormones, which is also called as ACTH. If you see, adrenocorticotropic hormone, ACTH. Next, gonadotrophs, it secretes gonadotropins, which includes 2 different hormones. So gonadotropins are mainly, again it will be direct question for your 2-mark question, list the gonadotropic hormones. Then you have to mention FSH and LH. FSH is nothing but your follicular stimulating hormone, and LH is nothing but your luteinizing hormone. Clear? Next, see, whatever we discussed now, the same thing only with the functions it is depicted here. So you can have a look. So what is GH does, what TSH exactly does. See, it stimulates the growth and activity of the thyroid gland and secretion of T3 and T4. So that is main importance of the TSH. So everything it is clearly mentioned and it is already been discussed also. So only thing I should, I need to add one more point is, see, to make it more clear on the thyroid stimulating hormone, I would like to tell only one thing. See, when there is an hyperthyroidism, see, there are 2 types of disease conditions that you can generally see when it comes to the thyroid disorders. So one is your hyperthyroidism and one more is your hypothyroidism. So when there is an hyperthyroidism, the secretion of T3 and T4 will be increased. Understood? So high T3 and T4, which is called as increased secretion of T3 and T4, will be there in hyperthyroidism. So then if thyroid secretions are increased, what about the thyroid stimulating hormone? Then it is inversely proportional. Inversely proportional means, see, if T3 is increased and T4 is increased, TSH will be decreased. And if T4 and T3 is decreased, TSH will be increased. So this will be inversely proportional. So what you have to remember here is only always you should remember about the thyroid hormones instead of one more which is called as a TSH. If increased T3 and T4, it is a hyperthyroidism. Decreased T3 and decreased T4 is called as the hypothyroidism. So when you want to correlate with the TSH, then obviously, as I told, a simple concept is it is inversely proportional. So you can easily identify the parameters of it, and this is how you will be able to diagnose the disease condition when it comes to the thyroid condition. Clear with this? So this is for your knowledge purpose, and also when they ask in the examination which hormone will be increased in the hyperthyroidism, you should mention it is a increased secretion of T3 and T4. Clear with this? Okay. Next is functions of the ADH. What is ADH? Antidiuretic hormone, which is also known as vasopressin. ADH is also known as vasopressin. It controls the amount of water in the body by regulating the production of urine. So as I told, the amount of water in the body by regulating the production of urine, mainly it will be taken care by the antidiuretic hormones only. Main function is to retain water by acting on the kidneys. Okay. It conserves the amount of water in the body by decreasing the amount of urine excreted by the body in order to prevent the dehydration. It stimulates reabsorption by the kidneys. So reabsorption will be taken care by the main purpose of the ADH is, so it stimulates the reabsorption by the kidneys. Okay, that is one more thing, and to retain the water in the body. These are the two functions that you can highlight when it comes to your examination part. So functions of an ADH is a repeated question. Functions of an oxytocin already we have discussed. This is also a repeated question. See, as we discussed, oxytocin is associated with sexual arousal in both males and as well as the females. During the sexual arousal and the activity, the oxytocin also will be released as an associating part. Okay, it causes smooth muscle contraction during the childbirth and also lactating mammary gland, that is during the lactation, milk ejection reflex will be initiated and stimulated by the oxytocin only. Clear with this? Next, alterations in the pituitary gland. So when you know about the hormones, like what exactly it does in our body, that also plays a major role. Like to know about in like at least by name you should know it instead of going in detail, because the disease condition in detail you will be studying in your future, like second year BSc nursing and third year BSc nursing. In that case you can go with that. But here you should know at least only the names of a disease condition, what it really causes. What are the alterations in pituitary gland is, see the disorders of growth hormone, disorders of pituitary gland. So like this they may ask for your 2-mark question. So in order to know that, like answer for that, you should know little bit about at least the names of the disorders. So disorders of growth hormone is, first is gigantism. It is mainly due to the overproduction of GH during adolescence. See, you can notice that the height and weight will be little bit high for the people. If you see, characteristics will be like a tall stature, bilateral gynecomastia will be there, which is enlargement of male breast, large hands and feet. So these characteristics where you can see is for the people or the individual who is having overproduction of a growth hormone during the adolescence age, that is the secondary sexual characteristics or physical changes will be there, right? Then these kind of like a gigantism disorder you can notice there, which is because of overproduction of growth hormone. So what is gigantism? Overproduction of growth hormone during the adolescence. Next is acromegaly. So acromegaly, it is due to the excessive secretion of GH during the adulthood. So in the adulthood, if there is an excessive secretion of a growth hormone, if it is noted, then it is called as a acromegaly, which is characterized by, so you can notice that broad, thick nose will be there, say enlarged nose, prominent forehead, and enlarged lips and tongues will be there, prominent chin and jaw. So everything will be enlarged. So enlarged faces will be there, thickening of the skin will be there. So these all will be the characteristics of acromegaly. Just for your again 2-mark question, because they may ask list the disorders of the or excessive or overproduction of growth hormones disorders. Then you have to mention gigantism, acromegaly, those things. Next, dwarfism. Dwarfism, again the name itself says dwarfism. Dwarf means something which is deficient or which is low. Deficiency of GH secretion is called as a dwarfism. So what the characteristic features you can see is shortness of stature. See, you can notice that they will be short in stature. Okay, small genitalia will be there, delicate extremities. So these will be the characteristics of dwarfism. Okay, so next is the disorders of ADH. So what are the disorders of ADH? Diabetes insipidus. So it is a condition which is characterized by excessive thirst. So excessive thirst is the main characteristic features of diabetes insipidus, which will be a disorder of the antidiuretic hormone, that is excretion of large amount of severely diluted urine will be there. So since there is a ADH is not working adequately, what happens is So dehydration will be very frequent. So because of that, increased thirst will be there and large amount of severely diluted urine will be there. Pituitary gland produces insufficient ADH, hence the kidneys make a lot of urine. Here insufficient ADH means decreased ADH hormone secretion will be there. That is why diabetes insipidus is started. Okay. Next, pineal gland. So this is also a 5-mark question for the GNM, whereas for BSc it is a 2-mark important question. It is a small body attached to the roof of the third ventricle and it is connected to it by a short stalk containing nerves, many of which terminate in the hypothalamus. See, it is usually attached to the roof of the third ventricle. See, you can notice that this is the third ventricle area, this is the roof of the, see here you can notice that this is the cerebrum part, pineal gland and pituitary gland will be here, and here anterior, posterior pituitary will be there, pons, medulla oblongata, spinal cord. So this is the anatomical section of the pineal gland for your understanding purpose. Here it is a 10 mm long, it is reddish brown in color, surrounded by a capsule. See, if you want you can notice here, see it is surrounded by a capsule, this is the capsule part. Okay. Next, the glands tends to atrophy after puberty and may become calcified in later life. So what is mean by atrophy means cellular changes. Okay. So again there will be change in the cells, either it may increase, so that cellular changes will be noticed, that is it may become calcified, that is increase in the cells will be there in the later life. It creates the melatonin hormone. So this is very much important. So what is very much important? This, it creates the melatonin hormone. So pineal gland, it is attached to the roof of the third ventricle which creates a melatonin hormone. So melatonin hormone is secreted by pineal gland. So the hormone functions and the, if you see the functions of the hormonal functions of the pineal gland is, first one, what is the main function of the pineal gland? It is the melatonin hormone into CSF and the blood. So it secretes the melatonin hormone into the CSF and the blood, that is the main function of it. And the other functions is it plays an important role in inhibiting the gonadotropin releasing hormone, which is also called as a GnRH. So GnRH means gonadotropin releasing hormone. So it inhibits means it stops the GnRH production. It coordinates the circadian rhythm, that is biological clock, such as sleep and wake cycles. See how we are sleeping, how we are getting, like what is the entire 24 hours of activity, when we want to sleep, when we want to get up and when we want to actively work, how this all maintained is what is that biological clock we call it as. So this, what is this biological clock means? It is called as a circadian rhythm. That entire 24 hours what we are doing and how our body is active and how it is getting exhausted, everything will be controlled by which hormone? That is this melatonin hormone only. By that, like where this melatonin hormone is exactly produced is, it is produced by the pineal gland only. It controls the sex drive, hunger and thirst, and it regulates the puberty. So these are the main important functions of the pineal gland, which is mainly a hormone which regulates this, that is melatonin. Okay. So alteration in pineal gland. So what are the disorders that you can see? If it is increased or if it is decreased, what are the conditions that you can see is, first is calcification. And why? Because I told in the later days that whatever the capsule which is already there, that is, see the cell whatever it is there, it becomes a calcified. So because of over calcified, what it will become is, it will become a calcification. A common process that occur as a people age, calcification is when calcium builds up in the pineal gland, causing it to harden and impair its ability to produce melatonin. Okay. So mainly because of its calcification process, finally what will happen is the production of melatonin will not be proper, it will not be adequate. This can lead to sleep disturbances, sometimes linked to Alzheimer's disease, migraines and fertility issues. So you can notice that as ages, as age is getting increased, you can notice that Alzheimer's disease will be there, dementia will be there, migraines, fertility issues also will be there. Why means because of one of the parameter is because pineal gland will be affected. Why? Because of a calcification process where melatonin hormone will not produce adequately. Next, tumors. So because of, I told no, cellular changes. So because of cellular changes, sometimes there is a high chances to get that cells to turn into the tumor, that is a cancer. Hydrocephalus, life threatening, which may cause us a built up of CSF pressure. So hydrocephalus, that is water in the brain, that is what we commonly call as. So enlarged brain head is called as, huge head is also called as hydrocephalus only, which is also called as water in the brain. Next, the hormones of thyroid gland. Clear? So this is all the alterations in the pineal gland, that is calcification, tumors and hydrocephalus, that you can mention for your 2 marks. And next, hormones of thyroid gland. So what is the hormone that are mainly involved in the thyroid gland and how it is produced and what is the production of thyroid hormones, everything we will discuss in detail. The thyroid gland secretes the following hormones, that is number 1, tetraiodothyronine, which is also called as a thyroxine, which is also called as T4. Triiodothyronine. See, tetra means 4, tri means 3. That is why the name came as T4 and T3. Clear? Tetra means 4 iodothyronine, tri 3 iodothyronine. T4 is also called as thyroxine. Thyroxine, understand? So what are the hormones? This is again important question for both the GNM and BSc. It is a repeated question. Name the hormones of the thyroid gland. So you have to mention T3 triiodothyronine, T4 tetraiodothyronine, calcitonin and thyroglobulin. So these are the 4 hormones of thyroid gland. Next, coming to the alterations in thyroid glands. So what are the alterations in the thyroid glands are? Hypothyroidism and hyperthyroidism. Already have told one point as a brief, just let's discuss in detail here. Hypothyroidism, it is the condition which is resulting from reduced circulating level of T3 and T4. Hypo means decrease. Thyroidism means it is a disease condition. So what is means thyroidism means disease condition because of less production, which is also called as production levels. Decreased thyroid production hormones or decreased production of thyroid hormones is called as hypothyroidism, that is decreased level of T3 and T4. Here, now you tell me, already we discussed that if decreased T3 and T4 means what will be increased, whether TSH will be increased or decreased. So obviously since it is a lower part, it will be the increased part, means it is inversely proportional. So in this condition what will happen? Decreased T3 and T4, so increased TSH will be there. Next, what are the features? You can notice that there will be a goiter, puffiness of face will be there, periorbital swelling, loss of periorbital swelling means eye swellings will be there, puffiness of face also will be there, loss of scalp hairs will be there, hair falls will be there. Ptosis, ptosis means see drooping of upper eyelids, automatically the eyelids will fall like this, okay. See, ptosis in child, ptosis in the adult, eyelids will fall down. Next, dry, thickened and rough yellowish skin will be there. So these are the characteristics of hypothyroidism, which is very much important for 2 marks. Next, coming to the hyperthyroidism, which is also called as Graves' disease. So Graves' disease is an important 2-mark question for both the people. It is the condition which is resulting from increased circulating level of T3 and T4. Here, T3 and T4 hormones will be increased. There, it was decreased. So here you tell me whether TSH will be decreased or increased. Obviously, since levels of T3 and T4 are increased, the TSH will be decreased. So hyperthyroidism features is moderate enlargement of the thyroid gland. See, you can notice that evident goiter will be noted. X ophthalmos, which is lid retraction, eyelid retraction we call it as. What is this X ophthalmos means? You can notice that, see, eyes periorbitals will be like instead of orbital swelling, here the entire orbit or eyeball will be protruded outside. You can notice that eyeballs will be protruded in the hyperthyroidism and goiter will be there, that is enlargement of the neck also will be there. See, what is mean by goiter? Again, it is an important 2-mark question. Any enlargement of the thyroid gland, is called as a goiter, which is caused by the iodine deficiency. This is an important question. So what is mean by a goiter? Enlargement of the thyroid gland which is located in the neck. It is mainly happens due to the iodine deficiency only. That is the main cause why goiter will occur. So what are the features? Is swelling in the neck, breathing difficulty, cough, hoarseness and swallowing difficulties. See, this much severe it will become if at all we are left untreated, okay. So this is the disorders of the thyroid gland, that is hyperthyroidism and hypothyroidism. Specifically hyperthyroidism, it is all about your goiter. So next is hormones and functions of the parathyroid glands. Parathyroid glands, so the name itself says from the thyroid there is one more part which is called as a parathyroid. In this, what is the hormones that are secreted by the parathyroid gland is parathyroid hormones. Parathyroid hormone is the hormone that is secreted by the parathyroid gland and it is mainly essential for maintaining the blood calcium levels. So in our body, how the blood calcium levels are maintained normally, in the sense it is mainly because of the parathyroid hormones. Thyroid, if you take thyroid hormones, understood? So what are the functions? Parathyroid hormone maintains the calcium levels in the blood, that already we discussed. Parathyroid, in the sense like parathermone, which is also called as parathyroid hormone or parathormone also we will call it as, decreases the blood level of the phosphate by increasing the urinating action. Parathermone decreases the blood level of phosphate by increasing the urinating action, bone formation and resorption. See, mainly these two. Instead of this, you can go with these two functions, that is the first and the last. Main function already we know, it is mainly responsible for the maintenance of calcium levels in the body. Second, bone formation and resorption. The bone, why it is so much of strength, why it is so much of strong, it is mainly because of the maintenance of the calcium, which is mainly done by the parathyroid hormone. Okay, bone formation also, calcium plays a major role, which is mainly like secreted by the parathyroid hormones. Okay, so what are the alterations in the parathyroid glands are? Hypoparathyroidism. What is hypoparathyroidism? Hypo means decreased, parathyroidism means it is your parathyroid hormone. So it is an abnormally low level of calcium in the blood. Okay, instead of saying body, you can tell as a blood. It is an abnormally low level of calcium in the blood. Why abnormally it is said means, calcium low in the blood, it is not a normal sign, right? It is an abnormal sign. So it is an abnormally low level of calcium in the blood. What are the features that you can see? Psychiatric disturbances, paresthesia, that is weaknesses will be there, development of cataract. So these will be the things. See, these are the areas which is called as the parathyroid. See, increased parathyroid hormones, that is low level of calcium will be noted. Hyperparathyroidism. What is hyper? That is increase. That is increase. So excessive secretion of parathyroid hormones will be a characteristic feature of the hyperparathyroidism. Here, what all the other features that you can see is, you can see formation of renal calculi, because overproduction of calcium usually results into the renal stones. What is that renal stones are called as? Calcified renal stones we will call it as, which is also called as renal calculi. Okay. Polyuria, increased urine, difficulty in urine, which is called as a polydipsia, anorexia, absence of hunger will be there, and muscle weakness, anorexia, which is also specific term, we call it as loss of appetite, general fatigue will be there, calcification of soft tissue. So these will be the characteristic features, main characteristic features or signs and symptoms that we can see in the hyperparathyroidism. Clear? So what are the alterations of the parathyroidism is hyper and hypo. Next, coming to the thymus. See, thymus, where it is located? See, larynx, thyroid, trachea, and next, like above the lungs, if you see, there will be a thymus which will be located over there. So this is the thymus place where it is located. The thymus gland was previously discussed in the lymphatic system lesson. So that already we have discussed in the cardiovascular system as well. Hormone produced by the thymus gland, which is called as a thymosin. The hormone mainly produced by the thymus gland are called as a thymosin. This is an important 1 mark question, because we know in this chapter we will be having one MCQ for the BSc, whereas the GNM also you will get like either the fill in the blanks or the MCQ as well. Hormones that is mainly produced by the thymus gland is dash, then you have to mention as a thymosin. So thymosin is very much important. These hormones mainly promotes the proliferation and maturation of T cells. What is this T cells? See, thymus produces 2 cells. One is B cells and one more is T cells. B cells is all about your bone marrow cells, and T cells, it is all about your thymus cells. Okay. So instead of telling only the thymus, even sometimes even you can include the B lymphocytes. Lymphocytes are of two types, one is B lymphocytes and T lymphocytes. B lymphocytes will be having a B cells, T lymphocytes will be having a T cells. B lymphocytes all about your bone marrow, and here it is a T lymphocytes, that is T cells, that is all about your thymus. So that is, so to know where exactly it came from, that is the reason it had been shared here. Okay. Next is why this T cells plays a major role in the thymus gland, as a thymus gland is, see, white blood cells which destroys the microbes and foreign substances. Why white blood cells came here is, as I told, lymphocyte. So lymphocyte, where it came? Again from the white blood cells. So white blood cell will be having one of the parameter which is called as the one of the type of lymphocyte, like a WBC cells is lymphocytes. In that lymphocytes, two are there, one is B and one more is T. So that is why white blood cells which destroys the microbes and foreign substances. This is the main function of the T cell. Thymic hormones may also help to retard the aging process. So this is very much important. So which hormone helps to retard the aging process is thymic hormones, that is thymosin. Clear? Next is hormones and functions of the thymus glands. So what are the hormones and functions of thymus glands is, see, the main hormone which produces the which is produced by the thymus gland is thymosin. Thymosin is the hormone which is secreted by the thymus gland. Functions: this gland matures the T lymphocytes and therefore regulates the immunological processes, that is immunity. Okay. T lymphocytes, one developed and matured, will migrate to lymph nodes and spleen to provide the cell mediated immunity. So mainly T lymphocytes or T cells or thymus plays a major role in immunological responses. Okay, that is the main function here. Synthesizes hormones that regulates the rate of development of lymphoid cells and particularly T cells. Okay, that is the T cells. So what are the alterations in thymus gland that you can see is, see, myasthenia gravis, pure red aplasia, hypogammaglobulinemia. Myasthenia gravis, pure red aplasia and hypogammaglobulinemia. So these are the three alteration disease conditions that you three disease conditions that you can see when there is any alteration in the thymus glands. Okay. So these will not be asked like a direct question, just to know as an alteration part. Okay. Next, coming to the pancreas. The pancreatic gland have a both endocrine and exocrine function. So already we have discussed this. Pancreas will be having a both exocrine as well as the endocrine function. Okay. Exocrine part, it secretes pancreatic juice. Endocrine part, it secretes insulin hormone. So that is why it is called as both exocrine as well as the endocrine function. So that is why we also call this pancreas as heterocrine. Okay, heterocrine, endocrine, exocrine and heterocrine. So location, epigastric and the hypochondriac region of the abdominal cavity. Here if you see, so this is the pancreas where tail, body, head, all three will be there. Where in center if you see, there will be a blood vessel type. That vessel is called as a duct. So duct means anything which is opening. Okay. Endocrine, pancreas distributed throughout the gland, which is close proximity to the capillary networks, which are groups of specialized cells which is called as a pancreatic islets of Langerhans. See, this is very much important. Name the cells which is produced by the pancreas, in the sense you should mention as pancreatic islets of Langerhans. Pancreatic islets is a cell, of Langerhans is the place. Okay. This is the important question that you can expect for your one mark for both GNM as well as the BAC. Next, the hormones and functions of the pancreatic glands. Pancreas is a mixed gland, that is a heterocrine gland. The islets of Langerhans contains 4 different types of cells. I told like islets of Langerhans, pancreatic islets of Langerhans. It is a pancreatic cell. So actually it has 4 types of cells which secretes 4 different hormones. Each cell are the subtypes. In that subtypes, each cell will again give a different hormones. So what does it exactly secretes? Alpha cells secretes the glucagon, beta cells secretes the insulin, and delta cells secretes somatostatin, and F cells secretes the pancreatic polypeptide, which includes delta and F cells. Here if you notice, delta and F cells are less than 10%. So if when compared to other 4, you can notice that these 2, that is delta cells and F cells, will be having less than 10% comprises only. Okay. So what are the 4 important islets cells of the pancreas are, these are the 4, that is alpha cells, beta cells, delta cells and F cells. Alpha cell secretes glucagon, which is a repeated question, and beta cell secretes the insulin, and delta cells somatostatin, and F cells secretes the pancreatic polypeptide. Here you know what are the cells of the pancreas and what is meant by pancreatic cells of islets, pancreatic islets of Langerhans cells, that also you know. Now, if there is any change, that is either decrease or increase in the pancreatic hormones by the pancreatic cells or juices, what will happen is there will be alteration in the pancreas. So, what is the disease condition or condition that will be resulted when there is any change in the pancreas, pancreatic cells or the pancreatic hormones which are produced by the pancreatic cells? So, first is diabetes mellitus. It is an important question that everyone knows this term. So, it is nothing but in simple term we call it as sugar. Diabetes mellitus, it is a group of metabolic diseases in which there are high blood sugar levels over a prolonged period. High blood sugar levels over a prolonged period. It is not like 1 day or 2 days, it is like a prolonged period. This high blood sugar, this high blood sugar produces the symptoms of, what are the symptoms that you can see is frequent urination, increased thirst and increased hunger. So, frequent urination, polyuria, increased thirst and increased hunger. If these 3 is noted in any of the individual, then they are said to be, they are showing the signs and symptoms of the diabetes mellitus. So, which is very much important to just immediately look into it and go to the nearby hospital to undergo the diagnosis. Okay. Next is type 1 diabetes mellitus. So, in the diabetes mellitus again there are type 1 and type 2, so which is very much important for your 5 mark for the GNM, since it is a, for a BSc, since it is a 2 mark, you may definitely expect 1 2 mark question from this. So, define diabetes mellitus and explain the type of diabetes mellitus. Type 1 diabetes mellitus is, it is also called insulin dependent diabetes mellitus, which is also known as juvenile diabetes mellitus. Insulin dependent diabetes mellitus, IDDM, which is also called as IDDM. It can occur at any age, but usually occurs before the age of 40. Okay. So, this, if it occurs before 15, 20 years or 25, then it is said to be the juvenile diabetes mellitus. So, what are the symptoms that you can see in type 1 is high blood sugar levels, low blood sugars, feeling hungry, weightless. High blood sugar, low blood sugar, why it is means there will be fluctuation of the blood sugar levels. Type 2 diabetes mellitus, this is the most commonest diabetes mellitus that will be seen in most of the individuals after 30 plus. Okay. It also called as a non-insulin diabetes mellitus, which is called as NIDDM, non-insulin diabetes dependent diabetes mellitus. Here insulin non-insulin dependent. Okay. Here it is completely insulin dependent. Usually it occurs after the age of 40 only, hence it is known as maturity onset diabetes mellitus and may or may not be associated with ketosis. Okay. So, ketones plays a major role here. So, that is why it may or may not be associated with ketosis. So, what are the symptoms here? Glycosuria, osmotic diuretic, which is also called as osmotic diuresis, and polyuria, polyphagia, polydipsia, coma, circulatory shock. So, these are the symptoms that you can see in the type 2 diabetes mellitus, which is very much important for your 2 marks. Okay. Next is hyperinsulinism, hypoglycemia. How diabetes mellitus? There are 2 types. Next to diabetes mellitus, other alterations that you can see in the disorders of pancreatic cells or alterations in the pancreatic hormones are hyperinsulinism and hypoglycemia, gluconoma, insulinoma. Hyperinsulinism is dysinsulinism due to hypersecretion of insulin. Obviously, hyper means increase, insulinism means increased production of insulin levels, insulins by the pancreas. Hypoglycemia, decreased blood sugar levels less than 50 mg per dl. Gluconoma, it is a tumor. Noma means anything which ends with the oma, then it shows the suffix which is called as a cancer, oma. Insulinoma, again it is a tumor. cancer. Tumor of the pancreas that is derived from beta cells and secretes the insulin. Clear with this? So what are the symptoms of hypoglycemia is very much important. So that is why it is mentioned here. So there will be shivering, that is a tremors or trembling will be there. Faster heart rate, tachycardia will be there. Extreme hunger, excessive thirst will be, excessive hunger will be there. And sweating and confusion, difficulty concentrating will be there, and dizziness. So these are the symptoms of the hypoglycemia which will be noted in hypoglycemic condition. Clear with this? Next is adrenal or suprarenal gland. So what is this adrenal or suprarenal gland is? Adrenal glands are a pair of important endocrine glands which are located on the posterior abdominal wall or over the part of the kidney. See, on the top of the kidneys you can notice that there will be some like cap-like structures which will be placed. So these two cap-like structures is called as the adrenal glands, that is right adrenal gland and left adrenal gland. Okay, so right kidney and the left kidney. So if you take one, you can notice that the outer covering is called as a cortex and the middle layer is called as the middle part is called as the medulla. So it is orange in color, 4 centimeters long, 3 centimeter thick. These are the anatomical structures. Here we are focusing much on the physiological part only. It has two parts, that is outer part is the cortex and inner part is the medulla. What are the hormones that are involved here is in the adrenal gland. See, adrenal cortex and adrenal medulla, two parts are there in the adrenal gland. If you talk about the adrenal cortex, the hormones that are produced is cortisol, corticosterone, cortisone, aldosterone, androgens. This is an important question which is a repeated question as well. Name the hormones which are secreted by the adrenal gland, or name the hormones which are secreted by adrenal cortex. So that is the question. Adrenal medulla, if you talk about that, epinephrine and norepinephrine, that is adrenaline and noradrenaline. Clear with this? Next, coming to the alteration in the adrenal cortex. So if there is any change, either increase or decrease, so what will be the condition that will be coming under the alteration in the adrenal cortex? Are number one, Cushing syndrome. So Cushing syndrome, it is a repeated question. So first thing you should write, see if at all they ask a Cushing syndrome, then you should write a first heading is, it is a alteration in adrenal cortex. Okay, it is an adrenal cortex disorder, like that also you can mention. It is caused due to the hypersecretion of glucocorticoids. It is an important and repeated question. What is Cushing syndrome? It is mainly caused due to the hypersecretion of glucocorticoids. That is very much important. So what are the features? Pain in face, neck, and even in the abdomen. Pathological fractures will be there. They are very prone to get fractures. Diminished protein synthesis, and protein synthesis will not be adequate. Suppression of growth will be there. Growth will not be adequate. Poor deficiency of growth will poor or deficiency of growth hormones will be there. Hypertension, menstrual disturbances if it is an woman, peptic ulcers. So these are the features that will be there if a person is having a Cushing syndrome. Okay. Next is Conn's syndrome. This is due to excessive secretion of mineralocorticoids. It is usually caused by the tumor affecting only one adrenal gland. So if there is this Conn's syndrome, usually it is caused by the tumor which is affected only one adrenal gland. See, only one adrenal gland, not the both sides. Next is Addison's disease. It is due to the hyposecretion. Hypersecretion of glucocorticoids will be your Cushing syndrome. Hyposecretion of glucocorticoids and mineralocorticoids will be your Addison's disease. This is the differences between them. So what are the effects? Muscle weakness, vomiting, diarrhea, tiredness, mental confusion, low blood volume will be there, hypotension, and even loss of body hair in the urinary bladder. Okay. Next is local hormones. So what are this is an important question, that is why it is clearly mentioned as a separate slide. So local hormones, it is an important question for 5 marks for the GNM, and BSc it is a repeated question for your 2 marks, where 2 times even they have asked. What is the local hormones is? List the local hormones, that is how your questions will be there. It is mainly secreted by a body tissue to act locally, that is number 1, histamine, serotonin, prostaglandins, erythropoietin, and gastrointestinal hormones. So name the 4 hormones. Local hormones means you should mention, but try to read 1 extra always so that you will be in the safer hands. Histamine, serotonin, prostaglandins, erythropoietin, and gastrointestinal hormones. So this is called as local hormones. And if you see, here I have listed multiple hormones with their nicknames. Why? Because in this chapter, as already we know, we will be getting maximum 2 marks for the BSc nursing people and 2 marks for the short answers and 1 mark for the MCQ. So totally maximum 3 marks you will be there, where you can expect only these kind of questions only. Understood? So what are those hormones and nicknames that you may expect as a question is, number 1, adrenaline, which is also called as fight or flight hormone. They will ask like, mention dash is the flight or fight hormone. Then you should mention adrenaline. Noradrenaline, emergency hormone. Insulin, sugar controlling hormone. Glucagon, anti-insulin hormone. Thyroxine, metabolic hormone. Cortisol, stress hormone. Melatonin, sleep hormone. Oxytocin, love or bonding hormone. Next, dopamine, feel good hormone. Serotonin, happiness hormone. Endorphin, natural painkillers hormone. Estrogen, female sex hormone. Progesterone, pregnancy hormone. Testosterone, male sex hormone. Prolactin, milk secretion hormone. And ADH, which is also called as a vasopressin, it is a water saving hormone. And parathormone, which is also called PTH, calcium raising hormone. Calcitonin, calcium lowering hormone. So these are the hormones which plays a major role like in the endocrine system. To know few things as a nickname, it is mandatory, because these will be your direct MCQ questions for both GNM as well as BSc. Next is the placental hormones. See, placental hormones and its actions also very much important for your 2 marks. Placental hormones and their actions are, see, we all know placenta is the like a part or an organ which is giving a connection from the mother as well as to the baby. Okay, it is a tube-like structure which gives a connection between both. Human chorionic gonadotropin, progesterone, estrogen, placental lactogen, parathyroid hormone, relaxin, and corticotropic releasing hormone. So these are the placental hormones. So the placental hormones is an important 2 mark question. Repeatedly they have asked, even in your 4th year exam, like 4th years also, for 4th year BSc nursing, then you will be studying in detail about the placental hormones in the OBG. Okay, so that you should know the brief little bit here. So how the question will be here in the sense, describe or list the placental hormones. Okay, then you have to mention any 4. So human chorionic gonadotropin maintains corpus luteum. Progesterone maintains uterine lining. It inhibits the uterine contraction and maintains, estrogen maintains the uterine lining, stimulates mammary glands, and placental lactogen, if you see, it stimulates the mammary glands and supplies energy to the fetus. And next, parathyroid hormone, that is, it increases the blood calcium level, and relaxin, it softens the cervix and weakens pubic symphysis, which increases next is corticotropic releasing hormone. Here it increases the heart rate, blood pressure, blood glucose, and stimulates the parturition. Okay. So this is the hormones which is called as placental hormones, which is very much important for your 2 marks. So we came to an end. So the hormones, local hormones and nicknames of the entire endocrine hormones is very much important for your 2 marks. So please ensure try to read in a smarter way than only putting the hard work from your end, so that it will be helpful to score you much marks. So any doubts regarding the endocrine system, please let us know so that we can discuss in the future or upcoming classes as well. So thank you.